We're going to talk about acute low back pain today. It's very common, usually doesn't mean anything really bad, but it can really bother you. Before we do that, let's go over some caveats. If you do have low back pain and you can't pee, then you go right to the emergency room. Please, please, please do that. Also, if you have weakness of your leg, go see your doctor. So here you are, it's the first week of your low back pain and you're miserable. Let's go over a few things you can do. The first and probably most important thing to do is to try to stay as active as you can be. Whatever you can do, figure out the edge of your performance envelope, put yourself there. Just go be active. The next thing you can do is, as you're being active, is to try to do some McKenzie stretching exercises. Just Google this. There are a million different ways to do it. Pick one and start doing some McKenzie stretches. That usually helps make things better for you in the long run. Another thing that's very useful to do is to take about 400 milligrams of Motrin, ibuprofen, along with about 500 milligrams of Tylenol, about 4 times per day. We have a video about this on the drrods.com website. You should look it up. And finally, you might want to put a little ice on your back for the first few days, and then start experimenting with ice versus heat, because if you do a little bit of both, that will often help. So you're as active as you can be, you stretch, you throw a little medicine on there, Motrin, Tylenol, ice, then heat. Your back's been hurting for a month now, and you're still pretty miserable. Now's the time to get another pair of eyes, maybe a physical therapist, a chiropractor, a massage therapist. Have them take a look at you, make some suggestions, and see what can be done about this whole thing. Similarly, it may be time to try some prescription medication. In general, things like muscle relaxers, a nerve agent like gabapentin, Lyrica, a Medrol pack, we've got a video about that on the drrods.com website, are all good ideas. As it turns out, narcotics are not used that much anymore because they don't work very well. So if you've been going 6 weeks or so with mostly back pain, maybe a little bit of leg or butt pain, now's the time to get some imaging, usually an MR if you can get one, and then think about a referral possibly to a surgeon or a pain doctor. This is a very reasonable step to take at this juncture. Okay, so to recap, in that first week, you want to be active. You're going to want to do some McKenzie exercises, do some Motrin, Tylenol, get some ice or heat on your back. In that first month, you're going to want to add in some PT, chiropractic, a massage therapist perhaps, maybe some prescription drugs. If you're still pretty miserable at 6 weeks or so, then you're going to want to get some imaging and then possibly also a referral. And finally, the caveat, okay, if you stop peeing when your back hurts, you got to go right to the emergency room. Or if your leg gets weak, part of your leg gets weak, then you should see your doctor right away. And that's it. This material is provided for educational purposes only. The content contained in reference here does not constitute medical advice, diagnosis, or treatment. You should always contact your own healthcare practitioner before beginning or changing a course of diagnosis or treatment. And yes, we really have to say this. Check out our website, drrods.com, for lots of videos on your neck and back, including the anatomy of your neck and back, how arthritis affects that, various treatment options, our very favorite operation, the anterior cervical discectomy, fusion and plating, and why and how you should get a second opinion. There's lots more there. So head over to our website for lots of videos, plus a blog with some cool things that are going on that we find from time to time. Check out our Facebook page where you can interact with our patients and see what they have to say. And check us out on Twitter where you can get my micro rants. See you there.